All right, welcome to On Scene. I'm Mason Matthews.
I'm Joey Huffman.
Awesome. Well, man, we want to do a topic today that I think's pretty important. A lot of people, we know us as, we're 911. We call 911. A lot of people, we teach our kids. Your whole life, you think, man, something's really bad, we'll just call 911. We want to today. I think it's pretty important. You and I have been talking about this for a while. I want to do an episode on this, but what happens when you call 911? What does that look like? Then what happens, with us getting to the scene? What happens when we get on scene, right? Which is pretty appropriate for our show title. Yeah. And then, what happens after that? If I decide I want to go to the hospital, how does that look? So we're going to cover kind of all aspects of calling 911.
Well, Mason, one of the things when we were talking about doing this, one of the things that I really wanted to get across is, I think sometimes our community's perception or what they expect is maybe drawn more from what they've seen on TV or something like that, and maybe not necessarily the way that it really is. And, we've had some questions before. We've said, hey, why do y'all or why don't y'all do certain things? And we just want to bring awareness to why we do what we do. There's reason behind every bit of it. And I think today's a really important topic. So I'm glad we're doing it.
No, I agree. There's obviously we have policies at the fire department, but there's also laws. There's a lot of legal ramifications to what we can and can't do. And sometimes, especially in emergent situations, the people that have called, adrenaline's flowing, emotions are involved. Sure. And that's not the time, right? Mm-hmm. They do have these, a lot of times our communities do have these perceptions that may be inflated with some, TV shows and drama.
Some grandeur.
It is. Yeah. And I watch those shows too. They're cool. But that's not always exactly the way it is. It's not real life.
Right. Well, you remember TV shows, what gets ratings is drama. Yep. And, and don't let this baby face fool you. At almost 30 years of doing this, I've been on a lot of EMS scenes and or fire scenes or emergency scenes, and there's enough drama there when we get there. And so much of our job when we get there is just to bring to take the chaos down.
Turn the volume down.
Turn the volume. I love that. Turn the volume down. Yep. Bring the drama down. So sometimes the public expects that we're going to do something, act in a manner, or be amped up, if you will. And we don't want. In fact, we want quite the opposite of that. We want to be bringing the volume down to get control of this situation and bring about the best outcome.
No, what it's that saying about smooth is fast and fast. I mean, it matters. And we do this a lot. I mean, it's our job. You said 30 years. 30
years. A lot of it.
You think of a 911, someone calling 911 and it being an emergency. It is the biggest thing in their life.
Absolutely. Absolutely.
It's our fourth one before lunch.
And that is the truth. That is the truth. And I don't know if people always recognize that. And we're not demeaning that today is your emergency. No. Absolutely not. And that's why we're here.
We're in the business of taking it serious.
That's what we do. And so every one of these is important to us. But we want to prioritize things. Sometimes the things that we talk about this with some injuries sometimes. Whenever we're training our paramedic students, sometimes there's a very gruesome injury. We call that a distracting injury, but that's not what's going to kill them. No. It's something else that they're not seeing. So when we get to the emergency scene, what seems really important to you may not be the most important thing, and we have to address those important things first.
It is, and you're right. That does not make it less important.
Absolutely.
It's just as the person that's there trying to mitigate this emergency, we do have to prioritize. And it is all to, whoever's injured the worst goes first, those types of things, because people's lives are going to depend on that and getting them to definitive care and things like that. So, so I do think this is a pretty important topic. And let's start right where, the 911 call gets placed.
Yep.
One, let's talk about why you call 911. That's one of the things
I think that's a great place to start.
I do a lot of public education and go, teach a lot of different demographics, school age, all the way up to retirement facilities. Yep. And everybody's reason for 911 is vastly different.
I don't know if anything amazes me more than I've seen people on both ends of the spectrum. Some folks will call 911 for things that you and I would never dream, like this is not an emergency. Right. And then some folks will not call 911 no matter how bad it is. And that's what we're here for. So,
yep. The thing is, The answer to that question, what is 911, is really whatever it is to you. And that is why you get such an array of what is emergent to somebody versus what is, this isn't as bad. And that's different for everybody. The answer is if you feel that it's emergency and you feel that it's 911, please call 911. There is, when you call the dispatch center, we're going to talk about that in a second, but when you call 911, you are San Angelo Police and Fire Emergency Dispatch, which is a separate entity in itself.
Absolutely. Yes.
It's an actual center that is separate from the police department, separate from the fire department. It's a call taking center. So they are not police officers. They are not firefighters. They are dispatchers.
Right.
They're taking your call. They do have non-emergency numbers there as well. So obviously they're answering all the 911 calls, but if this is one of those things like, I think I need something, but I'm not really sure.
Right.
There isn't a non-emergency number, and I think Brian can put that graphic up for you.
And if you'll tell the dispatcher, sometimes they're able to help you with, so this is not an emergency, you just need transport. We have non-emergency services, other places that we can give you those numbers and let you contact them and get a non-emergency ambulance if all you're needing is transport.
Right.
And sometimes just telling the dispatcher what is going on, it will help. They'll help you with that decision.
Well, I do know, if you're not sure, right, and you're thinking, well, if you call the non-emergency number, they cannot transfer you to 911.
Gotcha.
If you call 911, they can transfer you.
That's a good point.
So if you're just not sure, start with the 911.
Gotcha.
Hey, is this an emergency? Well, they can transfer you to that non-emergency line.
Gotcha.
And that kind of like takes the heat off.
I don't guess I realized that.
But you can't do it the other way.
Okay.
So if you're not sure, start with 911.
Okay.
And call. So when you call, the way that this works is, and I've been down to that dispatch center. I'm going to tell you, I thought my job was hard. Showing up to the man, I'm on scene. I'm dealing with the sights and the sounds and the smells, and man, I got the tough job. And you walk down into a dispatch
Brother,
center.
they're busy.
They
are busy.
It is wild. I don't even think about, we're so used to, right, we're at the station, we're alerted for a call, we get in there and we go and we mitigate getting to the scene, we get on scene, deal with everything, deal with the end. And I think, that was just draining. I don't even think about what happened before they alerted me to go get in my vehicle and go. It's just,
it's not even like they can just focus on one thing. They're taking a call in this ear, they're listening to the radio and the guy's talking to them in this ear.
Yep.
It's hard for me to listen to one person say one thing, much less multiple people saying multiple things, and it's a tough job.
I'm going to tell you, I do not think I could do that. I do not think, listening to this, taking the call, listening to this person reporting this emergency, and then on this side, they're talking to firefighters, they're talking to police officers. We're asking questions too, right? We're going to this thing blind.
Right.
Oh, okay. So I'm going to this wreck. I'm going to
Right.
this fire. I'm going to this medical emergency. What's going on there? What is the patient saying? They're getting it in this ear and they're relaying it.
Yep.
So they're clicking back and forth. It's wild. You think about a fire here in town. We see smoke. You know how many people call? And that's great. We want you to be vigilant.
Absolutely.
We want you to call a wreck.
Absolutely.
Everybody driving down Knickerbocker that's passing that wreck, they're all calling just to make sure. And we want you to. Please don't assume somebody did
Absolutely.
call.
Absolutely.
But man, they're 10 calls on one wreck, and it's all the same wreck. Are they trying to decipher? Is there another wreck?
While
Is it a
the
different wreck?
dispatcher's trying to get the units there,
it's wild.
And continue to take calls. So
So-
it's a busy job. They have a very hard job.
It is.
You just be aware of that when you call it. They've got a lot going on as well.
Yep. So the way this works is, they're sitting in front of a computer screen. We talked a little bit about their communications that are in their ears, but if you've ever called 911, it starts with 911, emergency dispatch. What's your emergency? And I'm going to tell you, right? You can imagine if you've ever called 911 or you're thinking about you calling 911, what kind of emotion is going to be built up with you at the time, the urgency in which you're trying to get that information out, the adrenaline that's pumping. You're gonna have to really. It's gonna be tough. Try to calm yourself down, because when you are giving them this information, they are going to build a response that they think you need.
They're trying to understand what you need, not what you're saying.
They're trying to decipher all your information. It matters what your name is. It matters your location, and not just the address. I'm just at blank facility. Well, how many buildings are at that facility? How many? Is it the south side? Is it the north side? Are you inside? Are you outside? Are you in a parking lot?
Sometimes the person calling is not where the emergency is.
No.
There's a lot to work through there.
There's a tough.
And so please try not to get frustrated with the dispatcher as they're asking questions and you say, I just need help and I need it now. They understand that and they're doing their best to get you that help, but they have to have some pieces of information to get the right help to the right place.
Well, it matters. If you call, hey, this is Mason, I need an ambulance, I'm at this address, click, and you hang up. That's probably all you're getting. Did you need police there? Did you need, not giving enough information is going to yield a response that's probably not going to be the one you want. You're going to have to slow everything down for a second. Hey, your name matters, your location, your precise location matters, and what you think you need. How many people are hurt? Is there more than one? Do you need more than one ambulance? We've only got so many units in town. We only have so many police officers, so many fire trucks, so many ambulances. So if this is something that's involving multiple patients or the potential for multiple patients, that information needs to be relayed to the dispatcher. So they're taking this information. They have a protocol and a policy as well. Ask this, ask this, ask this, ask this. And as you're giving them this information, they're grabbing these units in their software program. Okay, there's an ambulance. Certain types of calls automatically warrant a response that look, from the fire department and the police department. If you call and say that they're trying to find out is say it's a medical emergency and they decipher from the caller that this is cardiac in nature, heart related. Right there, you're getting an ambulance and a fire truck. Right? Why? That's going to yield what that kind of call could turn into is going to need the extra hands. Right? You only have 2 people on an ambulance, 3 people on a fire truck. And then how many officers, right? Is there crowd control needed? Is this in the roadway, right? So all that stuff matters, and all that's got to be relayed to the dispatcher.
And there's so many different things, so many aspects of this. The guys here lately, we have had a rash of dog attacks, and so we've gotten a call saying, "Hey, my buddy, my wife is got about a big laceration on her leg," and then we get there and we can't get to them because the dogs are still out. And if they had just been relayed, the dogs are still out. We need police, we need animal control. So then we're not delaying the care to this patient because we don't get there. We still have a problem.
And other things, wrecks, power lines are down, they hit a pole, things like that. I mean, that already that dispatcher, what you're getting ready for, is, fire department's going to be calling for electrical provider. We're going to be calling for other services. But if you can get all that stuff out, it absolutely matters. Hey, I've made contact with both people involved. No one's saying that they're injured. That kind of stuff matters too. So try to get as much as you can to the dispatcher.
I didn't mean to interrupt you. When you call, if you're not sure what to say, the dispatchers, they're going to ask you the questions that they need. Allow them to ask those questions. And sometimes I think the callers again, it's their emergency. I can appreciate how frustrating that is and how energized they are at that moment. But the dispatcher is going to ask the questions that they need to get you the help you need. So if you get lost in this, the dispatcher is going to ask you. They're going to lead you to what it is that you need.
I agree. Well, and be prepared to receive some information.
Absolutely. Great point.
If you call, maybe you are the 3rd or 4th caller. Maybe help's already on its way. Maybe you're calling and relaying some information that's new to the incident that the first 2 callers didn't say.
Great point.
So
Great point.
If they're hey, this is going on. Oh, well, man, I've already got an ambulance on the south side of that building. Help could be 100 yards away and you don't even know it because you hung up. So be prepared to receive some information if you need to as well. Not only can you call 911 here in San Angelo, but you can text 911. Really big deal. I teach a lot of active attack type classes, stop the bleed classes, where we talk about acts of mass violence and things like that, where people may be in a situation where they're trying to be quiet, domestic violent type situations, anywhere where it is not advantageous for you to pick up the phone,
make it obvious that you're calling 911.
You can put 911 into your phone, send text message, and you can converse with the dispatcher, which is just like calling and talking 911. That's a huge resource we have here in San Angelo. A lot of people don't know we have that, but if discretion's needed for the communication and with 911, you can do that over text message. And they, like I said, the dispatcher, just like they would be talking and asking those questions, they're sitting at the computer and they'll be conversing with you.
I had to start thinking about all the scenarios that you could use that where you needed to be discreet for whatever reason.
Huge. One question that I think is interesting, a lot of times I get asked, well, what if I'm driving down the road? And I used to think of this is weird. I used to think of this when I was young. You're going on family vacation, you're driving down the highway somewhere, you're out in the middle of nowhere, and you think, well, if we called 911 right now, how will they know where I'm at? Like, I live in San Angelo. Would I get San Angelo's 911 if I'm out between San Antonio and it will geolocate, right? So if you're using a mobile, it geolocates with their with the towers that it's hitting to that 911 area. So you don't have to worry about it when you call 911 and you're in Dallas Fort Worth. You're going to get that 911 center.
Now the dispatcher may still ask you, where are you at? What's the closest? So you're on the highway. What's the last town you went through? How long ago was that? Just to try to make sure that we're talking about the same
and be
place.
vigilant. If you're on those highways, what mile
Absolutely.
marker, what
Pay
mile
attention.
marker, landmarks that you've just passed. Those things matter, and you never know when the emergency is going to happen. And if you're just 3 cactuses ago, it's not going to work. So knowing where you're at and just being vigilant of where you are, because you never know when the emergency is going to hit. So, okay. So we know, we've talked about calling 911. We've talked about texting 911 if you need to. We've talked about what happens in the dispatch center. They're taking the information, building the call. Now they've alerted those units. Okay. All right. And we're going to obviously talk from the fire department side. I don't want to speak for the police department. Just so you know, so we have 8 fire stations here in town, strategically placed all over. 6 of those stations all have an ambulance and a fire truck. 2 of those stations are really just have fire trucks. Good thing is all San Angelo firefighters are all paramedics and firefighters, which is good because if you get a fire truck and or an ambulance, you have a person that's trained to a medical scope of practice that's all the same, which is the top level as paramedic. And that's why we do that. But basically, we're at our stations and we are really, for lack of a better word, just waiting around for emergencies to happen.
So I'm over at Station 5 and
the busiest.
For one,
busiest.
There's not a lot of waiting around.
No, there's not.
A lot of calls come into that station, and there's plenty of stuff to do. I mean, but yes, our primary job, we always position ourselves, posture ourselves that when the bells go off, we're ready to go, no matter what we're doing, working on the truck, working on the station, doing training, whatever that is, at a moment's notice, our primary responsibility is when those tones go off, we go.
Yep.
And so that's
constant state of readiness is the word I hear all the time.
Always.
And that can be exhausting. When you think about it, when I go and teach at the schools, I'm teaching young children about 911 and talking about firefighters and EMS and things like that. If you think about it, 365 days out of the year, 24 hours a day. Okay, there are 50-ish firefighters and paramedics, dual certified people sitting around at those 8 stations just waiting. Holidays don't matter, time of day doesn't matter, weather doesn't matter. That's what we're there for. Yep. I mean, and that's what your tax dollars pay for, is for us to be there just in case. When you think about that, it's pretty amazing. I mean, it really is. That they're just waiting for your emergency, and anything that you could need.
And that just in case comes around a lot. What was our call volume last year? Was it 17,000?
So we do about 18,000 incidents a year for a town of 100,000.
That's a lot of calls.
That's a lot of calls. And that's anything and everything under the sun. EMS is about 12 to 13,000 of that.
Yep.
So we're definitely our heaviest call volume is going to be EMS related, but it's just everything you can think of, and if it went to that dispatcher and the information yielded a response by the fire department, that's where those incidents come from. But like you said, so all 8 stations, firefighters are sitting around waiting, right? The tones go off, our guys go out and get on their unit. There's a lot of times people will call and say, and you see us running lights and sirens all the time. We call that code 3. Code 1 would be with normal traffic, no lights, no sirens. Code 3 would be lights and sirens. But let's talk about, a lot of times people will call 911 and ask for a code 1 response. Hey, so you've called 911, right? To relay your emergency, okay? And then you ask for us, hey, but don't come emergently, right? A lot of times we aren't going to follow that. You want to speak to that a little bit?
So when you're calling 911, our initial assumption, our immediate assumption is that you have an emergency. Usually, if it's not emergent, then you will utilize other resources, other departments. Again, we talked about
That non-emergency number.
the non-emergency ambulances that are in town.
Yep.
So if it's not an emergency, then they're expecting that you would have utilized those first or tried these other avenues. So that by the time it gets to 911 and the fire department is dispatched, at this point, we're assuming you have an emergency. There is something limb or life-threatening going on. Your property's in danger. You're in danger. A situation that is out of your control. And now you're needing help to mitigate that. And so we're coming, and we want to get there as quick as we can. And sometimes what somebody else would interpret, and we're not there at the house, where they're making the call from. So sometimes what they would interpret is, oh, it's not that bad. It can get real bad in a big hurry.
Has the potential.
It has the potential. So a lot of times, like I said, even with the request of, y'all don't come, with your lights and sirens on. I'm sorry, we're really we need to respond as quickly as we can to get there.
Well, and not only is dispatch gonna err on the side of caution,
absolutely,
and assume the worst, we are too.
Absolutely.
So what's happening there is, and let's talk about code 3, because we are making that assumption and we are erring on the side that this could be life threatening, right? I mean, that's the top of the top, and it's life threatening to us when the calls come in and we know we have an emergent response. That's what we're assuming, right? That the property is in grave danger and or person is in grave danger, and we're going to respond accordingly. That's where that code 3 comes in, right? So we've got lights and sirens going. Man, one of the coolest things that I ever thought, I'd give a little tricks of the trade away, and I get asked this a lot by kids whenever I'm teaching, is do y'all have buttons that change the lights from red to green? We do. Not all lights do, but why is that? So when we have lights and sirens, I think there's some misnomers about, or some misconceptions about, if they got their lights and sirens on, they can blow red lights, they can do it, everything.
Oh, no.
We are asking. So those lights and sirens are not a slam dunk. It does not mean that we get to just break laws and do things like that. That's not how this works. Can we flip lights and change it to make it advantageous for us to get the right of way moving? Absolutely. And if this is your emergency, you would want us to do that.
And again, it's not all lights. It's only main running lane, certain lights.
Yep.
And we do have a device that's able to do that. A lot of things have to go right for that to happen. It can't have, depending on where the light is in that cycle, those kinds of things. So don't automatically assume, oh, he's coming up behind me, that light's going to change green. That's not necessarily going to be the case.
It's not. We're asking for the right of way.
We're just asking
what those lights and sirens do. So if we approach a red light, we are anticipating moving through the light, but we are asking inversely, the other traffic that has the green light, we're asking you to stop. If we proceed through that light, we are really, we're taking a risk because we've asked you for the right of way. It does not mean that we just have an imaginary green light and just go through. But that's something, a lot of times we'll pull up and now we're blocked in by traffic in front of us, right? Mm-hmm. And we're honking our horns. We need to get to this emergency. We're not trying to be rude to you. Mm-hmm. Someone's called.
Yep.
They have an emergency. We're assuming the worst, and we're trying to get there, as quick as possible. A lot of times we end up we're basically asking for the right of way, but we're asking the traffic in front of us for them to inch out into, there's a lot of, use your best judgment there.
Sure.
But
we don't want to put anybody else in danger. No. But we are trying to get to the scene.
Right.
You hear that horn, and that's part of the problem is, we were talking about earlier how when you get into your own vehicle, you're now back in your own safe environment, and you got your music on, the air conditioner's on, and the kids are hollering and all the things that are going on. And sometimes you don't hear. And I get that. I understand.
Yep.
So if we're on that horn behind you, like, I hear you.
And we're expecting you. We're expecting you to not.
But we don't always know that you do. So if we're on that horn, we know that inside your safe space in that car, it's loud. You got things going on.
You could be jamming out.
So maybe you got a good day going.
Right. No, you're right.
That's great. But if we're on that horn, please don't be offended. They're just being ugly. We don't know if you hear us or not.
Well, and there is laws on the books, the move over,
Yes. And so you are supposed to, and let's just cover that briefly. And most people know that if you see an emergency vehicle behind you, you hear the sirens, you see the lights are coming up behind you, they are going to try to stay in the left-hand lanes in anticipation that you, the citizen, is going to move towards the right as far as you safely can and not cause an accident, out of the way and stop so that we can get by and go to where we need to go. Right. We have a lot of folks that will continue with their normal business day, regardless of whether there's somebody emergent behind them or not. If they were going to turn left, they will stay in that left-hand lane and continue to make their turn as they needed to do, as they wanted to do. It really does make it difficult for the emergency drivers, because now that person is not doing what we expected them to do, which is move to the right. So now we're not sure what they're going to do.
Right.
And so they're having to make adjustments and be careful, always being careful. But it's just, it is so much smoother doing an emergency run if the traffic in front of us, when they see us and hear us, will move to the right safely.
And we're driving big, heavy vehicles.
These things are carrying 1,000 gallons
just
of
the
water.
weight alone, right?
Yeah.
Now we're adding however many hundreds or even 1,000 gallons of water, right, to these fire trucks.
Almost
these
9,000 pounds of water.
I mean, we're talking, if there is a collision, it's not going to be good.
We had a car just the other day. They wanted the center lane real bad, and they saw an opportunity, and the driver, they're trained to do this. And so they're counting car lengths between them and the next vehicle, calculating all the time, how long is it going to take me to stop between me and the next vehicle?
Yep.
And a car went from the right-hand lane, got right in front of us, and then went to stop so that they could turn left. And my driver had to take an evasive action and hit his brakes and not hit the car in front of us. Yep. But I think sometimes you're assuming some things that may not be accurate, and those are big, heavy trucks, and these guys are highly trained. But please don't do that.
No.
Please don't just whip over in front of the fire truck and hit your brakes.
No.
And
on a previous episode, we talked about being, assuming versus expecting.
Yes.
And that absolutely, you need to expect that fire truck and or ambulance and or police officer is right. We are going to try to mitigate traffic and get to where we're going, and we are expecting. We're hoping that you obey, but we are also expecting that you might not. So we're trying to be defensive as well. But
not to beat that horse, like I said, we are going to try to go to your left. We're going to try to come around you to your left. If you can, please move right.
And the other deal there is that way oncoming traffic sees us as well.
Absolutely.
If we stayed all the way to the outside, when we get to these lights, the oncoming traffic has no clue we're even there. So we're just trying to be as visible as possible. But with those lights and sirens on, we are asking for that right away, and we're asking that you yield to us. And that just makes everybody safer, and it gets us to the emergency, which is the whole point.
Absolutely.
The whole reason. But the point I wanted to make there is when you're calling that 911, we are taking a risk, and we're putting other drivers at risk. So running that, when you're trying to think, is this my emergency or not? Do I risk everybody? Right? Do I risk all those things? And if that answer is yes, man, that's 911 all day.
I know we're kind of taking this chronologically through the process of a 911 call and the dispatch. But one thing I want to mention so that I don't forget it is, and there's times that we don't run lights. So let's say you've called us out for an emergency. What you interpret as an emergency. Yeah. We have the patient. We're taking them to the hospital. If the paramedics' professional opinion is that it is not emergent, what I mean by that is not indicative of going code 3 and risking
lights and sirens
to the hospital. We've had family behind us before. In fact, recently, they had the patient in the back of the ambulance. A family member got behind us, was honking their horn because we stopped at a red light, went around us. The family member went through the red light, and not in an emergency vehicle, and wants to know what's going on.
Well, their loved ones in there. I understand.
We absolutely get that.
There are, and I'm going to tell you, there are, and we'll get to a little bit of this in a second, but we have a process. We are highly trained on what to do. Is someone stable? Is someone not? And when we make those decisions, we are making the decision, do I need to put other drivers at risk because this patient's status warrants me getting there quicker? So if it doesn't, we're not going to.
We have rules and policies that we are bound by just like anybody else.
There's laws. I mean, there's laws involving that as well. So that talks a little bit, we talked about the call, talked about the response. Now let's talk about as we arrive on scene.
Can I take one more step backwards?
Please do.
Sometimes when we get there, I've gotten this response from the family before. Well, what took so long? I completely get that. Every second is a minute. Every minute is an hour in those situations. I get that. As Mason stated earlier, please remember, we have 6 first out ambulances that are spaced out over the city.
Cover the entire county.
To cover the entire county, not just the city, but the entire county. So when you've called 911 in the ambulance, you go, well, there's a fire station it's literally 3 blocks away. there's a very, very good chance that that ambulance is out on another call, and the ambulance that's coming to you is having to come from much farther away.
Yeah.
Honestly, it could be from
Literally.
all the way across town.
Which can be 3, 5, 7 minutes, because then you have traffic, construction.
Absolutely.
There's a lot of things that are going on there. All of our units are GPSed.
Yep.
We have districts, Station 7, Station 6, and they are kind of like zones for them to kind of stay in. But the way, when you call and dispatch drops that call, meaning they alert, what they're doing is that GPS is grabbing the closest in-service ambulance.
Yes.
So you are getting the closest one.
But I know for the family member, when they're having this emergency, that for them, they're expecting an ambulance that is 2 minutes away because the station is right there.
That one that's 10 minutes away.
Now there's one that's 10 minutes away because that ambulance is out.
There's a trip on the loop all the way around. That's going to, you're right. That's a really good point to bring up. And not to mention, that's once they're en route. We talked about a call happens, information's taken. We've got to get the information. We've got to decipher what do we actually need. Then the dispatcher grabs all those units. Then they have to alert the station. Then we have to go out and get in the unit. All that's happening. So and we understand that times fit, seconds feel like minutes, feel like hours, feel like days, but I promise you, we're coming, and you're going to get the closest unit.
But I definitely understand the concern or the confusion with that is why in the world took so long. I promise you got the closest ambulance.
You did. And we came lights and sirens.
Yeah.
So
now we're there. I'm sorry.
No, you're good. So as we arrive on scene, I know you and I have dealt with many phone calls,
concerns.
One of the questions I think we get asked the most is, okay, they got on scene, they showed up to my emergency, and they walked in. Okay, I'm going to tell you, this kind of goes back to talking about some of the emergency shows that you see, and there's lots of running involved. They hop out of their ambulance or the fire truck, and they come running in like a hero. Their cape is flopping in the wind. Yeah. I'm going to tell you something. We train our firefighters to not run
from day one.
It does not mean that we do not take it this serious. It does not mean that we are not as amped up or as taking this as intently as you are. It does not mean that we're rating this emergency as this one's not as bad. They're all bad.
Absolutely.
We know that they were bad. That's why we came lights and sirens. But I'm going to tell you, they are. You can imagine, right? Firefighters and police officers, first responders, all together, healthcare providers, everyone. If you think about what 911 is you're literally seeing things that the human shouldn't have to see. Okay, on a daily basis, on an hourly basis. Okay, then when you get there, then you have to go to work and do a job. So you've got to get over, oh my gosh, I can't believe I'm seeing this, and then I've got a process to work through that is not only a policy at our department, possibly the city, but also laws and liability involved with it after the fact. That is all happening
There's a lot going on.
Internally.
There's a lot
on the way to the scene, right? We're getting information, right? And I'm getting, okay, this is what I'm going to, this is what's happening there. And that's just the information that they have. I'm expecting that it's probably a lot more than what it is, but I'm already creating mentally in my head, what do I think it's going to look like? What am I going to do
What do I need to take?
What am I going to do second? What do I going to get out and get with me?
Sure.
But I'm going to tell you, part of that process is gathering yourself and being smooth. We are going to be fast, and we are going to work diligently and quickly.
I always like to say we're going to be efficient. Now, you're the perception of the one who's having the emergencies, perception of how fast we are and how fast I think we are, maybe different.
They waited 7 minutes for us to get there, right? And where are those guys? Oh, where are those guys? And that's where I was saying seconds turn into minutes, turn into hours. Golly. And I'm going to tell you, a lot of the times when somebody does have an issue with this and they reach out to us and we start looking at the times, man, call was happening in 30 seconds. It was dropped. Guys got it. They were en route within 30 seconds. They made it somewhere in 3 minutes that should normally take 10. They got out. They were in, and we're at the patient within 7 minutes. That's pretty amazing when you think of what happened. It just doesn't feel like that while you're waiting.
So when we've taken some of these concern calls before, some of the, it took 15 minutes to get. I know it took 15 minutes, and whenever we go back and look at the times,
it took 6.
It took 6 minutes to get there. But I know for them, we know for them, it feels like forever, and I get that it does. Something else about when we get there, we don't run. I know on some of the TV shows, like I said, drama sells, and so
It does.
drama gets good ratings, and so they want to add drama to the TV show. We are trained. We want to do just the opposite. We want to turn that volume way back down because there's enough drama going on. Us getting amped up
Not good.
and getting excited does not help that situation.
No.
And when you get excited, your focus kind of tends to narrow. And what I need them to do is take the whole picture.
Yep.
I need all of our firemen and our paramedics to see the whole scene. I don't need them walking into something that is unsafe for them. I don't need more patients. I don't need more victims of what's going on. They need to be taking everything in as they're coming up to the scene. And one of the ways that we train to do that is that you slow down and you
Slow
walk.
down. Yep.
You walk.
Yeah.
So I know that for them, again, the person having the emergency, the family members, I think this is one of the highest points of frustration for them is they didn't care. Oh, please. I promise it's not that they don't care.
No.
They are moving with purpose. They're moving with direction, but they're moving efficiently, but they're just not getting in a hurry.
They're also doing exactly the way they were trained.
And they're doing exactly what we've asked them.
Training, we always talk about, you fall back to the level of your training. That it matters.
Absolutely.
We have built it into them to calm down, not have that tunnel vision, take everything into account. Because if you show up and you become hurt, who's going to take care of the patient? Right now, we got to do this whole process all over again. Is in another ambulance, or another fire truck.
Saying, standard response equals standard results.
Yep.
And so we have had a lot of success in taking care of our patients, and we take care of a lot of patients every year. A lot of emergencies we care for, 17,000 of them every year. So we do this a lot.
Yep.
When you think about that, we're doing, gosh almighty, 12 to 1,500 runs a month. And so we handle a lot of emergencies, and we get a standard result, but it's because we have a standard response.
Yep.
And so this really does work. So please understand that part, because that's I think one of the biggest areas of confusion for a lot of our community.
We carry a lot of stuff on a lot of equipment.
Yeah.
The deal is because we're going to insert here, right? We don't know what we're going to, and any call can come in at any time.
Right.
We've got to prepare for that long before the call actually gets here. On the ambulances and on the fire trucks, we carry a lot of equipment on the truck, but we can only carry so much equipment in our hands.
Only that too.
This kind of goes back to the call. When you make the call to 911 or the text to 911, and you're giving them, hey, this is what's happening. This is what's happening. This is what I'm seeing. This is what I think is going to be needed. That matters, because when I show up, we have some standard policy things that, when you get out of the ambulance, you will carry this inside. When you get out of the fire truck, you will take these things inside. And any information you can give us that might warrant us bringing in something else.
Absolutely. Breathing and not breathing, moaning, any of that.
It matters. And I'm going to tell you, if that information doesn't get out, and people do make mistakes, right? Our guys do get amped up. We talked about that standard.
They're human.
They are. We may have to go back. That's why we brought all this stuff with us, is we may have to run outside and get those things. Right. And you probably will see running at that point. Going to retrieve something that, oh man, I needed this. You probably will see a much different, that's different, because now we're in the act of
well, they've already been into the scene. They know what to expect. They're not walking into something unknown.
Right. Yeah. Right. Good deal. Okay. Now let's talk about some of the dynamics while we're actually there.
Okay.
This is also sometimes a misconception. A lot of people think, well, the fire department's here. I got to do what they say. That's not how this works. There are our brothers in blue do have some abilities that we don't have, right?
Absolutely.
They are there to mitigate things. They are there to sometimes, if things aren't cooperating and things like that, they can make some things happen. The fire department doesn't have that luxury. You've asked us to come. We're now there, and we are there to give you a recommendation of what we think or we hope that you agree to. But that's really what it is you have to agree to it.
Now, we're coming with the expectation that you have, let's just take our average medical emergency.
Okay.
You're having a medical emergency, chest pain, respiratory issue, whatever it may be. We're expecting that you are wanting, when you call the ambulance, we're expecting that you are wanting EMS treatment and then transport. That's our expectation of that's our plan from when we get there. If we even see you, that's our plan.
It is.
We are not trying to kidnap you.
No.
We are not trying to detain you in any way. No. If you decide you don't want that, then you tell us.
And the entire system is set up with that expectation. you calling 911,
Yes.
them dropping it, us coming code 3,
Yes.
Lights and sirens, us getting there. It is our clinical judgment, right, that we want to take you to the hospital to definitive care to be checked out. That is the assumption. Okay. The only reason and the only person that can change that assumption is the patient in question.
The patient.
Either and not just who called, right? If I am there and I call for a family member, what this all goes to is if we're there for that family member, as long as that family member has an established decision-making capacity,
Yes.
that passes our assessment, and I think that they can make sound decisions for themselves, it is completely up to that person.
And your decision making capacity, who they are, where they are, that kind
What
of
year, what
Okay.
day is it?
Okay.
What can you answer normal questions that you should answer correctly? And if that answer is yes, there's some legal ramifications there. Is I can't make you do anything at that point.
We've had people, family members say, well, I have legal power of attorney, medical power of attorney, take them. And then we look at the patient. The patient is alert. They're oriented. They have all the decision-making capacity. And they say, "I don't want to go."
We could do a whole episode on medical power of attorney. I will tell you something. Medical power of attorney, and someone who can make medical decisions for someone, are set up for a lot of different reasons, and some of those are expectant reasons, and that expectant may be in a month, 2 months, 6 months, a year. That does not mean that you get to what I say goes, and they are going to do this.
It's almost always goes into effect only when the patient in question is incapacitated
and cannot make
unable to make
You're right.
rational decisions. When we're talking to the patient and the patient says, "I am fine. This is the date. This is what's going on. This is where I'm at. This is my name, my birthday. I do not want to go." Even if medically I agree with the family member, they need to go. If the patient refuses, I cannot take them against their will.
A lot of times we get asked, "Well, what do y'all think?" Well, what do y'all think? Okay. What we think, and I'm going to tell you our answer, even if this is not the words that come out of their mouth, our answer is we think you should go to the hospital.
The expectation was we came here to provide treatment and transport.
That is our advice to you. Our medical advice to you is to seek higher level of care, right? We are there in an emergency capacity to provide emergency treatment and emergency possibly transport to a healthcare facility for definitive care for whatever is happening to you.
So if you're ever asking us, what do y'all think? What do y'all want? We want you to go.
We want you to go.
But they need to understand again that medical power of attorney, the family members, whoever it was that called, sometimes facility members. Sometimes there's a misconception of some of the facilities around town, whatever that facility is or whatever capacity, that they have called for this individual. And then when we get there, they're expecting us to take them. And then we're talking to the patient. And the patient, again, is alert. They're oriented. And they're refusing to go.
And those can be tough because in a facility, they have a duty and they have policies,
Absolutely.
right? It is in their opinion that this patient or this person needs to go seek treatment. And then you get there and the person can answer all their questions. They are of sound mind. I just don't want to do that. Well, we think you got this going on. Well, I might, but as of right now, I don't want to go. And the answer legally for the paramedic is then you don't have to. We cannot arrest people. We cannot make you go. Really, the only time that we can just make an assumption and do something is if you can't answer us. You are incapacitated.
Right.
So what we are constantly working on as a paramedics is on consent.
Right.
Right. Meaning you're telling me yes, I will be. I would like to be treated and transported.
Right.
Or no, I don't want either one. Or yeah, hey, I'm fine with you treating me and assessing me, but I don't want to be transported.
Right.
You can do that as well.
Right.
If you can't answer the questions correctly or at all, we're going to work off what's called implied consent. And if you were in the right state of mind, you would say, of course, I want you to take me. And that's really the only time that we can make an assumption.
And some of the times that we run into that, there are medical issues, low blood sugar, things of that nature, having a stroke,
some substance abuse type situations,
intoxicated, behavioral
related
issues.
There's
a lot of different reasons that sometimes they are not their decision capacity is not there.
Right.
And so, and in those cases, again, we're working on implied consent at that point.
And I'm going to tell you, we do get there, and someone, family members call for someone, we get there. What are you not doing that? Well, and the person's saying, I really don't want to make a big fuss. I don't want to do this. And no, you need to. No, you need to take them. I agree, right? Would you like us to take you? No, the answer is no. Man, if they can pass, if they're in a decision-making capacity that is checked as good, We cannot force them to go.
Fully appreciate the family member's point of view, their loved one. They feel this is what's best for them. I completely understand. I'm not saying that's not what's best for them. I'm just saying that they still have legal rights.
They do.
And I'm not able to infringe on those if they are able to make decisions.
No.
And so I hate it for the family. We're bound by laws too.
I know a lot of times, people feel like, well, the ambulance is here, I got to go. The answer is not, you got to go. The answer is, do you want to go?
Yeah.
And it really is up to you. Well, what do y'all think? We've already told you what we think. It's assumed we'd like it. We'd love to take you down there. We'd love to take you to the hospital. But I do think it's important that people know that they do have rights, and they get to decide as long as they can check all the boxes that need to be checked. Anyway, can you think of anything on scene that we want to address?
Something else about the on scene is a lot of times what will happen is when we get there, again, you have the whether it's just the ambulance and you have one medic that goes to the family member to get history and one medic that's evaluating the patient, or whether you have the fire truck show up and the part of the crew goes over there, talk to the family, and parts dealing with the patient. Please understand that there are many times where time is of the essence. Severe respiratory trouble. Sometimes the patient is not breathing. They don't have a pulse. And the information that we need is very time sensitive.
Yep. We need it fast.
We need it fast. So there's been many times where I'm talking to the spouse, a family member of a patient who's in arrest, cardiac pulmonary arrest. And there's some bits of information, very specific information that I'm needing in a timely fashion. And I fully appreciate, again, where that family member is and their emotions. But forgive us if we have to keep redirecting back to the information that we need.
Yes. Medications, allergies.
Exactly. When's the last time you saw
what
them
was happening
up and awake? What is their history?
We have to know these things.
We really, really need to know these things, and time is of the essence. So it's not that we don't want to sit and visit. It's not that, but
we recognize there's a lot going on, right? You're dealing with the emotion of what's happening right there. That's my loved one, and now these people are barking questions at me.
Absolutely.
I mean, we do understand, but there is a reason. There is a reason that we're asking.
So please don't be offended by that. If I'm sorry, I really need to know this. What medicines? Please don't take offense to that. It's just important at that time.
One of the things we were talking about with consent, we are going to ask you to sign for that consent. Whether that's I don't want to go, right? We're going to ask you to sign something. We do everything digitally now. It's on a tablet.
Yes.
Well, we're going to ask you to sign. Hey, they showed up. Yeah, they checked me out. They told me that bad things, my condition could worsen if I don't go to the hospital. That's what you're signing. It's called a refusal. And then inversely, if you decide to go, we're going to ask for you to sign for that too. Yes, I did agree for them to do this to me. I did. Well, yeah, I'll go in the ambulance, but I don't want that done. You can do that too. Right. You are not. We have some guidelines that we're supposed to follow based on the emergency or based on your complaints or illness. That we're going to try to do. And if you don't want those things done to you, you can absolutely say no at any time.
I had patients who said, well, I'll go with you, but I'm not wearing that C-collar or laying on that backboard or getting an IV. That's fine. What I'll need you to do is just sign right here saying that I offered it and that you refused it.
I will tell you some hard and fast rules. You're going to wear a seatbelt. There's some safety-ish things. I'll go in the ambulance, but I'm not doing that. If we can't safely secure you in the ambulance, that's going to be. But if it's if you're mid-ride, I want out of here. Okay. I mean, we cannot detain you. We can really only work off that consent.
Obviously,
and that's a fluid,
things like police custody, things like that.
Yeah,
that's
those are different.
Those
are different.
Yeah.
But consent is a very fluid concept.
Yep.
And at any time, I want or I don't want, as long as you've passed that mental, that decision-making capacity element, we're going to honor your wishes.
Absolutely.
So, okay. Now that we've covered that, let's talk about transporting to the hospital. So someone either.
I had one more thought. I apologize. On scene, I've also had it where we're in a hurry. We're having to kind of toe tap the family member. I need this information. Where the patient is very sick. We need to get on the road. We need to get to the hospital. Code 3 tap. Emergencies that we're talking about. I've also had it the other way where we're in the ambulance doing 12 leads, starting IVs, doing things that will help right now.
Yes.
which would be counterproductive if we waited to get to the ER. And sometimes the family members outside the back of the ambulance, why aren't you leaving? What are you go? What are you doing?
Yeah.
I mean, there's things that we are required to do in certain instances. So please understand, I promise we're not back there
again, you talk about that standard, these medical practice guidelines, which is basically our playbook of what to do, when to do, how to do, there is some of those are time sensitive. If your emergency is cardiac related, I need to know what's going on with your heart, and it's important that I know now, not in 5 to 7 minutes when we get to the hospital. They're going to check there too, but we need to see where there are changes. I needed that. If you're having the symptom right now, I need to check that heart right now, because in 5 to 7 minutes, I'm going to do some things in the ambulance that might make your condition improve, and now we won't see that when we get to the hospital.
Well, another thing is one of the reasons that we've made this policy along with the hospital is that when we're transporting a cardiac patient, we're doing a 12 lead, we're suspecting a possible heart attack or MI, myocardial infarction, that when we do the 12 lead, that's being transmitted ahead of us to the hospital. The ER physicians are looking at that, and then they're alerting the cath team, the cath lab, hey, listen, we got somebody coming in that's going to need you as soon as they get here, so that whenever we get the patient to the ER, no time is wasted before they're upstairs in a cath lab and being taken care of.
Well, we are a rolling ER. I mean, what we're carrying, the equipment we're carrying in the back of that ambulance is most everything that they've got in that emergency room. So we are initiating that care in the field. And you're right. A lot of the diagnostic elements that we are going to perform, we're sending those results ahead of, so they are prepared. They know what's coming. They've already seen the issue. They know everything, and they're waiting. They're ready. They're building a response at the hospital as well. Let's talk a little bit about the hospital, and where we transport patients, why we transport them there. So as my role as San Angelo Fire Department EMS administrator, a lot of my job is compliance with state services, the laws regarding EMS and things like that. And I'm going to tell you, one of the things that is a very important thing is us transporting a patient to the closest, most appropriate facility. Most appropriate.
Okay.
What does that mean? What that means is if this patient is having a cardiac related emergency, that I take them to a facility that's rated, that has definitive capabilities to treat that patient accordingly.
Right.
Okay. Not as big of an issue here in San Angelo, because we don't have multiple hospitals. Right. We have multiple campuses, but we don't have multiple companies that are hospitals. Right. Very different than, say, some of your urban areas, in the state, all over the nation for that matter, where you do have multiple hospitals in a close, DFW,
and they specialty in different things.
Yes.
Right.
And you may have this hospital that is, top of the line cardiac center, but then you've got this hospital that's a top of the line stroke center.
Sure.
And they're 5 miles apart.
Right.
Which one do they go to? Our jobs as paramedics is to know, if I've got somebody with a stroke, they need to go to this level stroke center, stroke facility. If they've got this cardiac, they need to go to this level cardiac facility. In San Angelo, that decision's kind of been made for us. We are transporting, to in our healthcare system here in San Angelo. If you are picked up by a San Angelo Fire Department ambulance, you are going to be transported to our closest, most appropriate facility, which is going to be the downtown campus of the hospital. Yes. That we still get a lot of times. I want to go out here. This is where my my doctor's out here today. Right. The hospital, who is receiving all of our patients, really. They get to make that call. They have, their definitive services and their most appropriate moniker is at that downtown facility. So right now, as an EMS system, as the San Angelo Fire Department, it is our duty, it is our role, and it is our our standard that you are going to transport to the closest, most appropriate facility. The hospital has told us that closest, most appropriate facility is the downtown campus.
And by the hospital, we're talking about our medical director, those that help, that define some of the rules and regulation for us as an EMS provider. They have decided that this is where you will go. So it's not up to us. We go to one place. We've had 911 calls where we get there and they said, hey, I've got a doctor's appointment over at so-and-so's office here in about 10 minutes. Can you get me over there? I'm sorry, we can't do that. No. We only are able to transport to.
We talked about this a while ago. We've had off camera, we've talked about patients saying, well, then I'm not going to go at all. Or well, now I'm just going to get in my car and go where I want to go. You absolutely can do that.
Absolutely.
You know, we're not trying to hem you up or be rude about this. You know, it's very clear that our direction is to go, you know, to the downtown campus. And if you don't want to do that, you don't have to.
Absolutely not.
You know, you.
And we've had that.
We respect that. I respect that.
I want to go to a different campus. Okay. Obviously, you can do that. Need you to sign here saying you don't want to go with us.
Yep.
We will help you into your vehicle.
At that point, what we would do is we would have you sign a refusal for transport of the ambulance, and then you can take matters into your own hands. You know, a lot of times we've even offered to follow you over there.
We do that a lot.
In case something happens en route to the hospital, and we will do that for you. You know, we're not trying to make you do anything.
Sure.
You know, but we do have policies, and we do have things that we have to do. So, you know, with that being said, we kind of already mentioned this, but once we do initiate that transport, based off of this patient's status, is going to determine whether we go that code 1 or code 3 licensed sirens or not.
Yes.
You know, we're basing that on, do we think this patient's stable? Do they have the potential to become unstable? Right. Are they already unstable?
How time sensitive is the issue that they're having?
And the decision, it hinges on, you know, do I need to risk myself and the safety of myself, my partner, and this person, this patient that's now in my ambulance? Do I need to risk all their safety plus all the other drivers that are on the road? Do I need to risk everyone's safety because this person's status depends on it? And if that answer is a yes, it's a judgment call. Now there are some things that they're measuring stability versus instability, and if they're checking the box of unstable, they are, but it's also a judgment call. And I just think I need to do that. And then they have that ability to do so.
And I don't want to make anybody feel uncomfortable about when they see the ambulance or the fire truck running down the road, code 3. There's just inherent risk by going faster, by asking for right of way, by pulling up to red lights and then, you know, checking both ways and then going through. There's just inherent risk involved with those things. Yeah. And yes, many times what's going on, the emergency we're trying to get to, or the patient in the back is critical enough that it does warrant us to do that, but many times it doesn't. And again, as the family members of these patients, please try to understand, you know, there's a lot of experience in the back of these ambulances. You know, I'm 30 years doing this. You've been here forever. There's a lot.
Not 30 years.
Not 30 years, but
not that old.
It is in their best interest along with everybody else, and they're doing what is best for the patient.
I agree.
That's what we are there to do. Above all.
I know there's a lot of expectation that, okay, you know, I've called 911, they showed up, they treated me, now we're transporting to the hospital. When I get to the hospital, man, they're going to wheel me right back to my room. They're going to fix my issue.
Right.
Okay. Right. Because we talked about, we talked about 6 ambulances for the entire county. We have private non-emergent ambulances here in San Angelo. So there's lots of traffic being funneled to that downtown campus.
Oh, and it's not just our ambulances. Lots of small community hospitals from outside of here transfer into Shannon. Shannon is a huge hub. They provide a lot of high-level service.
The entire Concho Valley.
They get a lot.
There's a lot of traffic.
Ambulances, a lot of patients.
There's a lot of, and that's not even including the people walking in to the ER or that transported themselves or came by POV. It does not mean, unfortunately, sometimes, this is there is a process at the hospital, and they're going to, just like when we show up on scene, right? If I've got multiple patients, I'm going to triage those patients and say, man, and I'm going to rate them in level of priority.
Sure.
The worst goes first, all the way down to the least emergent goes last. The hospital's the same way.
Sure.
They only have so many beds. They only have so many physicians and treatments. And
well, I think sometimes the community, the public, is under the assumption, the perception that it goes numerically. I got here at number 6. They got here number 8. They got here number 10. Yeah. You're not at the
now it might in the front of the house, right, where you're walking in and they've deemed it to not be, oh my gosh, now it might be this one was here first. This one was here first. We are going into that same system.
Please know, whether you come in by ambulance or where you're walking through the front door, there's a triage nurse there. Patients are treated according to the acuity of the level of sick that they are, or injury that they are.
Yep.
And so, if somebody is hurt worse, is more sick, then please understand that they need to be seen first. And so I think sometimes there's a misconception that I'm just going to take the ambulance so I can go back there faster. That's not accurate.
That's not exactly accurate. When you get there, they are triaging and the ambulance bay where we're going to come in through and I'll just call it the back door, where we're going to come in through the back door. They're triaging the back door just like they are the front door.
Absolutely.
That ER, I mean, there's one funneling point, and they are having to, as an ER and as a hospital, decide wwho's the worst, who goes first. I mean, that is absolutely what's happening.
Absolutely.
So that's something I definitely wanted to bring up, is that it's not a ticket right straight to the back.
Now, if it is a true emergency and it's somebody's having an MI or stroke,
and the system is set up as assuming this was so bad you could not have just got in your car, drove down, walked in the front doors. You called 911. A whole response happened. We got there. We treated you. We went code 3. We came in like you are going to pass go and probably be moved back. But there is still that triage process still happening at the hospital. So.
Yeah, I just think that sometimes there's a misconception with the public that the ambulance is an automatic free ticket to go straight through all the waiting and get right to a room and do all of that, and that's simply not the case. You'll be triaged like everybody else.
Your condition's going to warrant you.
Your condition's going to decide where you're going to be. And honestly, it's not uncommon for people to come in by ambulance and end up in the front triage with all the other patients in the waiting room because it's not emergent.
You're right.
And so they end up, having to go that route.
Yeah, you're right.
So please don't. I know sometimes we have gotten some concern calls about getting to the hospital, and then why did I go to the front instead of staying in the back in the ER? Because of what we just talked about. Your condition's going to decide whether you are immediate or not.
It's nothing we're saying over the radio. It's nothing that we're alerting them and saying, oh, it's not this. We're getting there. And then the hospital's making their decisions because they've got to make treatment decisions as well. So it really is a system. It's not just
the whole way around.
911, the fire department, police department, and then the healthcare facility. It really is. And we work closely as a system all the time.
Absolutely.
So. Well, cool, man. Well, I think we got some good information out there. If you ever have any questions, you can absolutely reach out to the fire department at any time, or the dispatch center for that matter. I think we will have a graphic up there that giving you a number to call the fire department if you ever I'm not sure.
And
what do you think?
Always want to hear the concerns.
Please
no.
Do.
I mean,
please do.
I'm expecting, even though our guys aren't running, I'm expecting that they are moving with purpose and with direction and with, there's no time being wasted. They are moving efficiently, but please don't be offended if they're not running.
Not at all. And I'm going to tell you, you said, that standard response gets standard results. I'm going to tell you, if you do not feel, or you just wanted to check and see if that standard was followed, call us, and we will. I promise you, if that standard's not followed, we will correct it.
We're happy to address.
We are
absolutely.
We can't say we're trying to do a standard response to get standard results and not go and make sure that standard wasn't followed. We're always checking that standard against itself all the time. So
absolutely. I think that there's been. Again, maybe I don't want to say heartburn, but misconception, I think, is probably the best word. Confusion about some of how it works when we get there, and hopefully this will clear it up, and people will understand better. And again, if not, give us a call. We're happy to visit.
Please do. Well, good deal. Well, and for On Scene, I'm Mason Matthews.
I'm Joey Huffman,
and we'll see you next time.
Next time.